Live on Your Health tonight, a local surge in sick patients. It's getting a lot harder to protect your family from an infection. So here to talk to us about this is Dr. Ali Raja, Deputy Chair of Emergency Medicine at Mass General Hospital. Dr. Raja, good to see you.
You too, Erica. All right, I'm going to scooch this way because she sounds a little stuffy
I'm a little
myself.
congested.
All right, there are a number of viruses circulating right now, but let's start with norovirus, Dr. Raja. Tell us about it. Is this more contagious than the others?
It really is. You're right, Ben. There's a bunch of stuff going around right now. It's probably not a bad idea to scooch a little bit. But norovirus is pretty bad. It causes vomiting, it causes diarrhea, and it's really contagious. The way it spreads is that it moves from people who are sick to people who aren't, or from contaminated food, water, or even surfaces that someone with norovirus has touched. So the best way to prevent it, aside from a little space, is also to wash your hands, not just with hand sanitizer, that's not going to do the trick, but with soap and water. That'll really help from spreading norovirus.
And we should remember from COVID how to do that properly, right? So health officials say they're also seeing increases in the so-called big three: COVID, flu, RSV. Is one really more dangerous than another now at this point?
They can be, Erica. You know, it's a matter of age sometimes. So today I was working in the emergency department at the Brigham, and I saw a lot of adults because we don't see kids there. I saw patients with flu, and I saw patients with COVID, and some of them were pretty sick. We don't see kids, but RSV can be really dangerous for infants especially. But here's the thing, RSV, flu, and COVID, we've actually got vaccines for all three of them, and not enough people are getting them. So if you haven't gotten them yet, remember, it's still not too late.
All right, so of course, if everybody with the symptoms showed up at your ER, it would be a total mess. So what's your advice for patients if they're trying to decide whether they should go to the hospital, an urgent care, or their doctor's office? I know we talked a lot about this during the pandemic, but run us through it again.
You know what, Ben, it's always good to go over it because I always see patients in the ER who aren't quite sure whether or not they should have come in. So it's really busy in all of the ERs across the state. But if your viewers are having really mild symptoms, so a fever that breaks with Tylenol or Motrin, a mild cough, mild body aches, they can get away with calling their doctor's office or maybe even going to an urgent care. But I've got to tell you, if they are having chest pain, or if they are having difficulty breathing, or if they measure their oxygen saturation and find it to be low, they really should come see us. That's exactly what we're there for. That's what we show up to work for. We're more than happy to see them.
All right, Dr. Ali Raja with Mass General Brigham. Dr. Raja, good to see you. Thanks for your time.
Thanks, Ben. Thanks, Erica.
Yeah.